The following portion of Daytime is sponsored by Moffitt Cancer Center.
Head and neck cancers can form in different areas, including the throat, nose, and mouth. And when it comes to treatment options, the team at Moffitt Cancer Center can provide an individualized plan to address a patient's unique set of needs. Here to tell us more about Moffitt's Head and Neck Oncology Program is Dr. McMullen. Welcome, Dr. McMullen. How are you?
I'm great. Thank you so much for having me today.
Oh, thank you for being here to tell us about this. Let's begin with the different types of cancer treated by the Head and Neck Oncology Program.
So the Head and Neck Oncology Program includes a lot of different areas, all included in what we call head and neck cancer. It also includes thyroid cancer. So we're talking mainly about cancers that involve the lining of the mouth and throat, involving the sinuses, even sometimes inside the ears, sometimes large skin cancers of the head and neck. So it's quite diverse, covering a lot of different malignancies in the head and neck area.
Which is the most common type that you see, and what are some treatment options?
So the most common type of head and neck cancer is typically something called squamous cell cancer. And this can involve the lining of the mouth or the lining of the throat, even the sinuses, though that's more rare. The most common type of thyroid cancer is called papillary thyroid cancer.
And what are some treatment options for those types of cancers?
Fortunately, there are some various treatments that exist for these types of cancer. Often surgery is the first choice, but radiation is also a very good choice for a number of cancers, including especially throat cancers.
So if you're someone who is newly diagnosed, what would you suggest the first course of action should be?
The most important questions that the patient should be asking about is where they're going to be treated and what the level of expertise is in that person or the group of people that are taking care of them. We know that volume or case volume, the number of patients you see with that specific problem, really matters for head and neck and thyroid cancer. The outcomes are better if that's all you do. And in the head and neck endocrine oncology department at Moffitt, all we do is head and neck cancer and thyroid cancer.
What are some warning signs that people should look for these types of cancers?
Some of the warning signs of head and neck cancers that one might want to look out for include a sore in the mouth that doesn't go away after a couple of weeks, persistent sore throat or hoarseness, areas of loose teeth or poor-fitting dentures that does not resolve, lumps or bumps in the neck that don't go away after a couple of weeks. All important things to look out for and get checked with your doctor.
So if someone gets checked, turns out to have cancer, speak to what they will receive at Moffitt and what sets you apart from other cancer centers.
Typically, patients may start with their surgeon at Moffitt, but we involve a multidisciplinary team. We have all of our patients meet with nurses, speech pathologists, geneticists if appropriate, radiation oncologists, and medical oncologists. We have a multidisciplinary tumor board where all those folks are involved in the decision making for our patients. So they're going to be meeting a lot of different types of folks who have various areas of expertise to make sure their care is comprehensive.
Yeah, I'm sure that's very comforting. Doctor, thank you for your time today.
Thank you so much.
If you'd like more information, you can visit moffitt.org/outcomes. Daytime will be right back.
The preceding portion of Daytime was sponsored by Moffitt Cancer Center.